Thank you, Dr. Kavadi, for being with us here today. Here at this Symposium of Radiotherapy in Chile and Latin America. You, as the CEO of the American Society of Radiation Oncology, just presented about innovation in technologies, right? So we wanted to ask you about these improvements in the technology of radiotherapy in the United States.
Sure. Well, thank you for having me. It's a pleasure to be here, and this has been a wonderful meeting. Radiation oncology is a field that's very dependent on technological innovation. And as we are able to take care of patients with better equipment, we're able to give better outcomes. And this is manifested in many different ways. We're able to see the tumor better. We're able to target where the tumor is, to spare normal tissues better, and in the process, very precisely give higher doses of radiation to the tumor while sparing the normal tissue. And this results in better patient outcomes and fewer treatment-related side effects. And in order for this to continue, there has to be continued innovation by our technology partners, and there has to be investment in this new technology so patients can benefit.
About the innovation in radiotherapy, one of the main things that we have seen in the last few years is the rise of AI. How has artificial intelligence become a part of radiotherapy?
There are many different ways in which AI has been used, and I think this is just the beginning. There will be much greater utilization in the years to come. But just to give you a couple of examples, one is the treatment planning process is a very precise process that has taken time. And through the use of AI and different software technologies, what we're finding is the ability to come up with treatment plans faster is getting better and better. So that is one area where we're having it. A second area is often we have to contour where the tumor is, where the normal tissues are. With AI, we're able to do this in an automated fashion, and that is saving a great deal of time. The machines are becoming more automated. So all of these things result in greater reliability, greater consistency, potentially higher quality, and certainly savings of time. Another area where AI has been very beneficial is, in addition to the doctor and the equipment, there's a need for trained personnel. And oftentimes, trained personnel are in limited supply, especially in countries where radiation oncology is not as well established as it might be in the United States or in Europe. To have the physicists, the therapists, the dosimetrists that are needed to take care of all the patients, they're not easily available. And with greater automation, we're able to use technology to supplement where we have deficiencies in the numbers of human beings that can do the work.
And in the same line of this, the implementation of artificial intelligence in medical situations, so to say that, what do you have to say to the people that believe that AI will take over people's jobs? For example, that is one of the main concerns that you can see from people that don't really know about how AI is actually working with the professional.
Sure. You know, there's a saying that people in AI use, and that is, you're unlikely to lose your job. Actually, you may lose your job to AI, but not to AI, but to the person who is able to use AI better, right? So the risk is that if you are not able to adapt to new technology and to exploit its benefits, then you put yourself at risk. But so far, what we're seeing is that the benefit of AI in the hands of people that know how to use it brings great value. But there's no question that as we automate more things, the nature of jobs will change. Not necessarily that the jobs will go away, but that people have to adapt in terms of how they work and what they do. So AI will change the nature of employment, not necessarily that it will eliminate employment.
Okay, perfect. And so what about the people, the patients, oncology patients that are afraid of radiation oncology, what would you tell them about the benefits of radiotherapy, for example?
Radiation is one of the oldest cancer treatments there is. It's been around for 100 years or more. It has been tested over that entire period of time, so this is not something that physicians don't have a great deal of experience with. It's a time-tested treatment, number one. Number two, radiation is given to half the patients with cancer. So this is something that is part of core cancer treatment. If we're wanting to cure as many patients as possible, if we're trying to help as many patients as possible, if patients are going to avoid radiation, they run the risk of making decisions that hurt themselves. Okay? Cancer is treated with different types of treatments. Those treatments come together. And the best outcomes are when we're utilizing the benefits of surgery, radiation, chemotherapy, immunotherapy. All of these things have a role to play. And if patients are afraid, sometimes that fear is because of the word radiation, it's because of nuclear reactors, nuclear bombs, or accidents. But some of that fear is also misinformation. It's journalistic sensationalization, where you are amplifying things that scare people because it is easier to sell newspapers or TV. But doesn't do society any service. It doesn't do patients a service. The reality is it's a highly effective treatment. It's highly cost effective. And it is something that is easy for most patients to take with relatively few side effects. So what I would say to people that are afraid of radiation is come in and talk to a radiation oncologist, visit the facility, learn more about it. And what you'll realize is that your fear probably is misplaced, and the benefit is something that you should focus in on.
Perfect. And so to close about the conversation, you would say that these instances like this symposium and also the visibilization of radiotherapy as a benefit and not as something to fear throughout social media or throughout the media outlets, like a collaboration between every different area, not only the medical aspect, but also the communicational. What would you say that your final message would be?
I would say that the purpose of ASTRO, the purpose of radiation oncologists, are fundamentally to advance cancer care, to advocate for how our specialty contributes to that, and that what we have to focus in on is patient benefit. We are interested in curing patients with the minimal amount of disruption to their body function, to their social functioning, to their time with their families, to be close to home. And all of these come into play. One of the things that sometimes patients don't realize is our treatment is often non-invasive. We're able to treat a cancer without removing the organ. And this allows for greater organ preservation and greater functionality. So the most important thing is patients should get treatment that give them the best benefit. That treatment sometimes is radiation alone, many times is not. We're not here to say that our treatment is better than other treatments. What we're here to say is that all treatments work together to bring benefit. And the more we're able to get that message out, the more patients will benefit from that.
Perfect. Thank you so much.
Thank you.